There's an exciting story brewing in the town of Petrolia. The town, the hospital, community members have joined forces to create a master plan around how they're going to tackle community well-being together. Listen in.
When was the last time the town came to your high school to ask you what you thought about improving the town and making it better?
We said, do you revamp the Discovery because it's kind of run down?
There's no really activity set out through the town, like for our age group. It's just kind of like, oh, here's Canada Day, but then there's like the drinking tent and everything for the adults, and then there's a ton of activities for kids, but there's like nothing for us to go and do.
So teens aren't like running around or causing trouble, or what adults might think they're causing trouble. It kind of looks like it, but they're really not. They just don't really have anywhere to go.
Well, this is an incredible brain trust. It's really important for us to hear from you. Well, we're doing a plan for the town, but we're also doing a plan for the hospital. The big question is, how do these things come together?
If we work together, we can be stronger. And that's what it's all about.
You know, they say it takes a village to raise a child. It also takes a village to care for a patient. The whole notion of doing a master plan collectively addresses the whole piece around what happens to the patient when they leave the hospital, or more importantly, what's been going on with the patient before they even come to the hospital. This idea is novel. It has a lot of potential to improve the well-being of every citizen in the town of Petrolia.
I think this idea is going to set this community apart from all other communities in Ontario. I think this is a wonderful idea about thinking about the community and its health as a whole.
From the hospital side, I've never seen the hospital and a municipality or town partner and work together to maximize community well-being.
We like to be leaders here in Lambton and in Petrolia, and so I'm looking forward to it, and I'm going to support it any way I can, working with the Bluewater Health and the town and the LIN.
I'm excited about the whole thing. A little concerned, obviously. Change is always concerning for everybody.
We live very close to the hospital. We've had concerns. We still have concerns, I'm not going to lie. We feel better about the communication process, and we hope that it continues. So far, so good.
I like the idea of trails. Yes. Safe trails and ease of access to the medical facilities of any kind, whether it's the hospital or getting to their dentist locally or over to the drugstore.
Think about down the road in 20 years, how many people will not be driving?
I think hospitals are often the catch-all for things that ail a community. That was the way our healthcare system was designed. So for us to be proactive and to be actually assisting and working with the community, and the community assisting and working with the hospital, that's super exciting.
I think it's a unique opportunity. I honestly think it's going to be a template or a model for other municipalities across the province, because it just makes total sense. I see a great future for the town of Petrolia. I think that's something that's going to be we're going to be ahead of the norm here by a lot.